My name's Danny. I'm a student nurse today. Today I'm going to be doing the newborn assessment. Start off with hand hygiene. The first thing I'm going to do is make sure that the baby and the mother are, the numbers are the same, so we have the correct baby. There is no mix-up. I'm going to check the wristband, check the numbers. There's also a footband and the belly button cord, umbilical cord clamp that I could check. They do match. So my baby's in a deep sleep right now. And so the first thing I'm going to do is go ahead and check heart, lung, and bowel sounds and get a temperature. So I'm going to check the heart and lungs right now. For heart sounds, I'll check for a full minute as well as the lung sounds. I will listen to all 4 quadrants of the lungs. And for the heart sounds, I can go ahead and tap my finger because it's really fast and get the rhythm before I start counting. I'm going to check the bowel sounds. I'll check all 4 quadrants. Bowel sounds were active. The heart rate was between 110 and 160. That could be higher or lower depending on if they were in a deep sleep or crying. It could get all the way up to 180 if they're really fussy. The lung sounds will be anywhere from 30 to 60, and they were. This baby was a vaginal delivery, so I didn't hear any crackles in the lungs. If it was a C-section, there could be crackles because it didn't get that push that it was supposed to. Now, while the baby is still all wrapped up, I'm going to go ahead and check her temperature. I don't need to put a cover on because this is personal baby's thermometer. I go ahead and get in between the skin folds and the axillary. I'm going to click the button, wait till it beeps, and it is 97.7, so that's good. We want to make sure it doesn't get below that because if it does, then it's just a really rapid downward spiral that can go wrong. The bowel sounds were active in all 4 quadrants. Next, I'm going to go ahead and do my head-to-toe assessment. There are all the sides are up so my baby cannot roll out, just in case. First thing I'm going to do is go ahead and look at the baby's sutures, the suture lines in her scalp. They are not depressed and they're not distended, which could mean increased cerebral spinal fluid. And anyways, that puts pressure on the brain, and that's not good. There's no capsic succeneum, which would be from a vacuum, which that's just it's a big swelling on the head, and that would go down in a few days. Next, I'm going to go ahead and feel the suture lines. They are approximated, so that means that they are right where they're supposed to be. They're not overlapping or a huge gaping hole, except for in your the anterior and posterior part where there should be. I'm going to go ahead and check the baby's eyes. There's no discharge, no signs of infection. The eyes are in line with the tops of the ears, so that helps rule out Down syndrome. I can go ahead also check the eyes for jaundice. They would be a little bit yellowish orange. Or I can go ahead and blanch the baby's skin, and when I were to blanch, if the baby was jaundice, then it would be orange instead of white when you blanched. I can check to make sure that the folds in the baby's neck are clean, that there's not any milk left in there. That can just make sores for the baby. I check the nares, and they are patent. If they weren't, I would go ahead and suction the mouth, then the nares, because if I suctioned the nares before the mouth, then the baby has a reflex to suck in air, take a big deep breath, and then they could aspirate on whatever's in their mouth. Next, I can go ahead and check the nipple line. Both nipples are present, they're not indented, which indicates a regular term baby. Next, I can go ahead and check on her umbilical cord. There's no discharge around it. It's not bleeding. It doesn't have a foul odor. It's just drying up like it's supposed to be. I'll check the skin turgor for dehydration, and it bounces right back. You check that on the belly. I go ahead and check the baby's fingers and toes. Capillary refill is instant. There's 10 fingers, and then I'll try to keep the baby covered. And there's 10 toes. Capillary refill is good. Next, I can go ahead and check the genitalia of the baby. And this is a little female. And I would check the labia majora and minora. The majora should cover the minora, and it does, which indicates a full-term baby. I can also check for pseudomenstruation, and if there was pseudomenstruation, then I would just tell the mother that's normal. It's a little bit of a pink discharge that the baby has, and it's from hormonal changes from the mother to baby. She doesn't have any bottom sores or anything like that, so that's good. The diaper is below the belly button. It's a clean diaper that we just got put back on. Next, I can go ahead and flip the baby over. Keep her head supported and covered as much as possible. And the blanket is out of her face. So I'm going to go ahead and listen to lung sounds on the back. They're good. While I'm back here, I can go ahead and check for a straight spine or a tuft of hair or anything to do with spina bifida. Spina bifida occulta would be the tuft of hair, or it could be scoliosis if there was a crooked spine. While I'm down here, I can also check the bottom for any sores or anything like that, and there isn't any. I can, when I'm down here, check the gluteal folds. It's not our job to diagnose hip dysplasia, but we can certainly tell a doctor if we see something that we don't like. The gluteal folds are a little bit off, and the legs, one leg is a little bit shorter than the other, so I might go ahead and tell my doctor that I think there could be hip dysplasia. And then so next, I'm going to go ahead and swaddle my baby back up, so she's going to be warm. Swaddling a baby gives them the comfort that they would have in the womb. It keeps them nice and tight and secured feeling. The tighter the better. And when support their head. And that's how I would do my newborn assessment.